So, Doctor, you have run a very interesting program here. Can you tell us a little bit about the program?
Sure. I love this program very much. This program was for around 35 to 40 once leprosy patients. Now there are no more leprosy patients. They are under treatment, so they won't give the disease to anyone. They are very safe. So these are the people who are there for full 2 days, and nearly three-fourths of them cannot read and write, and they have not gone to school. Hardly two, three people were educated, but they have a lot of intentions to safeguard their life and encourage their children to study, go to school, and keep their environment clean, neat, tidy, and they want to aspire for some kind of change in life. So the organization which has conducted this program for them told us to impart soft skills for these people. You know, how to solve their problem, how to listen to the others, how to have a discussion, meaningful discussion, because this group seem to have a little bit of problems. Like when they come together, they fight among themselves. They don't know how to talk to each other. They don't know how to appreciate each other. You know, few of them are a little selfish. When gifts are given, when the donations are given, they fight among themselves. Okay, and also there's a serious problem. The children of these leprosy patients and their children, they don't want to identify themselves as the sons and daughters or grandchildren of these people. Okay, this wounds them a lot. So our own children, why they don't go away from us? That's the point number one. And point number two, when they are invited for meetings, they don't come. They don't come. They don't care. These people. So that these incidents really wound them a lot. So how to also stigma, still social stigma exists in our country, and they are not allowed to get into the bus, and people don't respect them properly. They ill treat them, because they didn't take proper medicine. The hands were they were affected, and legs were affected. They look like patients, but they are not patients. So during the past 2 days, we gave them a sense of self confidence. We told them, you have your own skills, talents, potentials, and power, and you can organize your life a little more. You can listen well. You can give feedback and receive feedback properly. Have a meaningful discussion. Come together, discuss over your problem, and have a clear outcome orientation, so that the outcome should help you and enable you to move forward rather than fighting among yourselves with tiny, small issues. And they seem to have picked up all points. They were very serious. None of them slept. The head of the organization told us, or sometimes they go walk out, they come here, they take some rest. But these 2 days, they were there full time. We gave them a little bit of physical exercises, some mental exercises, some group exercises, some talk, and they were completely engrossed in the session. And yesterday morning, I had a recap. During the 15 minutes time, whatever we covered on the first day, they were able to bring it out. They told, this is a point. I will go back and apply this particular technique with my child, with my husband, in our family, in our group, etc. And we thought, okay, there's some impact. There's impact of the training program. This is exactly what we wanted. May not be too many things, but some important points. When you go back, you have to apply. You have to have a meaningful discussion. You have to treat others properly. You have to take all this youth on board. If you try to neglect them, they will move away from you. So you have to give them a sense of confidence, bring them to your fold. Once they are closer to you, then they may take your advice, right? But don't boss over them, don't hurt them, don't shout at them. Take them on board. Okay. So also the children, tell them about the history, how you were brought up by your parents, so that they will understand what you did for them, and they'll be with you. So these are some of the things that we dealt during these 2 days. It was a very fulfilling program.
And for sure, it contributes a lot to make more health happen. Even,
Yes,
yeah.
yes.
Can you give us some insights at the end about leprosy generally in India? How many people are infected? What are the biggest challenges maybe for these people?
Okay. Actually, frankly speaking, I don't have the data how many people have the leprosy. leprosy. But all that I can say is now leprosy has been contained a lot. It has been contained a lot in India, and one of the biggest problem these people face is the social stigma. You know, nobody likes to see a leprosy patient. Nobody wants to sit closer to a leprosy patient. So, although they are completely cured, we all know it's a waterborne disease, and once you start taking the tablet, all the bacteria is all the whatever causes the disease is arrested, and you cannot contaminate anyone, you cannot spread the disease. But in spite of this particular fact, there is a little bit of social stigma, but very much contained now. Like smallpox, they say they challenge the Indian country. They challenge the smallpox is completely eradicated. So also, to a large extent, the social stigma has been eradicated, but still in some parts of India, it still exists. And these people, feel that, oh, there is life for us. We don't need to die because of this. There is a life for us. We can come together. We can live together as a community. And there are donors, there are funding agencies which offer them some funds so that they have training programs, they have some housing scheme, and they have some health camps, and their children can get educated, and some scholarships for the children, some resources to maintain the family. So on the whole, they find a new meaning in life. Once they were sidelined, oppressed, suppressed, and ill-treated, dehumanized, and today they feel we can have a meaningful life, meaningful living in this world.
Well, thank you for all the insights and for this interview, and we wish you all the best.
Thank you, ma'am. Thank you so
Thank
much.
you.
Thank you so much.